Hi everyone, Susan here. You know, one of my favorite fruits is talking about prunes and how prunes can actually maybe give you a good chance of increasing bone density, building bone strength. This is now 2015. I'm in Montreal with all the researchers from around the world who are working on bone health and nutrition, and I have Dr. Hooshmand with me here today. Is that pronounced right?
Bushman.
Here today, who's one of the researchers on prunes. And actually, what she's looking at is just how many prunes do we need to have an impact on bone. A few years ago, you remember I talked about the work of Ajarmani, Dr. Ajarmani. What did he find? Like 12 prunes a day, 10 prunes a day. Really seemed to help bone density, help to build bone strength. And now, some researchers are looking at actually a lower dose of prunes, which probably you'll be happy to hear about. Why don't you tell us about your research and what you're seeing?
Definitely. So Dr. Hooshmand started this work, and he started with 10 to 12 prunes per day. And we have done this study for almost a year with him, and 10 to 12 really showed effect. It increased your bone density, it's preventing your bone loss in postmenopausal women that they're at risk.
So 10 to 12, it really seemed to help increase bone density, reduce bone loss. Okay.
Definitely, yeah. So it's really helping. But now we're going to lower doses because a lot of people complain that 10 to 12 could be really, too much to take every day. So we designed this study to go to lower doses and see if half of that, 5 to 6, could be as effective as 10 to 12 because it seems like more feasible to have that much per day.
In fact, a lot of our listeners were doing those prunes, and many of you might identify with, well, it was great, I was doing those 12 prunes, but then I got kind of tired of that. So what you're working on is can a smaller dose, can 5 or 6 prunes a day have that same sort of beneficial impact on bone? So what are you finding?
So what we're finding is, yes, in 6 months study that we did in women 65 years to 80 who had osteopenia or bone loss, we have shown that 5 to 6 prunes can be as effective as 10 to 12, decreasing their bone resorption. So that's, a success. And we're hoping that, we can show similar things in longer term studies because we really need longer term study to be sure about the bone density.
So in just a short 6-month study, 6 months, they've been able to find that you decrease bone breakdown, and there's some signs that it may be that 5 or 6 prunes can actually enhance bone density.
Yes, so we have seen the improvement in the total bone density. But, probably if this study was for a longer term and, for 1 year, we could have seen the significant changes in the lumbar.
I see. So the total mineral content of the bone has increased, and now you're looking to see if in a year will the spine get stronger, the hip get stronger.
So at any specific sites, we can also see some significant changes.
We really encourage always a diet high in fruits, vegetables, nuts, and seeds, but certainly taking the step to get 6, 7 prunes is probably a wise idea. Why, that's only 2 a meal.
Yes, easy.
Thank you very much,
thank you
and we congratulate you on research, and you keep us informed so we can tell everyone.
Thank you very much.
Okay, thank you very much. Bye-bye.
Bye.